Today I've got such a guest, such an amazing guest, and it's a treat for me to be able to talk with her. She and I have had several interviews together on for her Hack My Age podcast. And Zora Benhamou is an expert in aging women, and she's a gerontologist who has deep expertise and personal knowledge of the issues that women face as they age. I can read about them. I have a wife, so I experience them as a husband in the home, but there's nothing like talking to somebody who not only has made a study of this, but is living through it and has created a powerful community that brings women together to exchange ideas, best practices, learn from each other to improve their health and navigate this time in life. So we're going to have a great, fun, wide-ranging conversation. Zora, welcome. Thanks for spending some time with me.
Oh, thanks for having me. I'm really excited about this conversation, and it's really an honor to be on your podcast. Thank you.
Start by telling us a little bit of your background, how you got involved in this.
Oh boy. Well, it depends what you mean by this because menopause just like I'm 55 now and
Mhm.
I am going through this transition myself as well. I am a gerontologist. A lot of people don't know what that is. This is just it's not a geriatric physician. I'm not a doctor. It's just somebody who studies aging and longevity. We look at the whole life course from birth to death, not just older adults, so that we do have a focus on older adults. And we try to understand why people age and why we get certain diseases. And my personal interest is how can we slow this down and improve our quality of life and our peak span, which is very similar to health span, and to live those lives, those years full of life. And not it's not just about lifespan. So that's part of my background. I got into that just because I'm from LA originally, and I've always been interested in health and wellness. It's kind of like your LA DNA. You just are. But my mother passed away when she was only 57 of breast cancer. And that's when I started to really hone down, going, oh my goodness, I hope this is not my fate. I just don't want to die early. And that's sort of sent me on a deeper trajectory into aging and diseases. So now I've got a master's in gerontology and I continue just keep learning and learning. And the menopause piece came. I really got into this space because I was doing a podcast for women over 50. And then it was my audience who says, look, we need more information on menopause. We want the menopause experts. We want the hormone experts. And this was a really wake up call for me and myself at the time. I was 50. And I thought, well, I should probably be paying attention to this because I'm going through it. I didn't know what perimenopause was as I was going through perimenopause. And I realized there's so little information out there about this transition and about the impact that menopause has on our future self.
Yeah, it's interesting because there is not only a lack of information in the general public, but even among clinicians, among practicing physicians and healthcare providers in terms of counseling patients. There's just not those conversations aren't happening, and that's where your information and what you've created really fills an important niche. I didn't know about the background and coming at this from a personal experience with your mother and breast cancer. And I think a lot of people would be interested to know, starting at that point, what did you learn are some of the best ways for, women looking to prevent breast cancer?
Oh my gosh. I've become obsessed with this topic. Anybody who has a parent or a family, somebody going through this, or yourself, you get a PhD in breast cancer because you want to have the best outcome. And so some of the best practices in terms of lowering the risk of breast cancer, just to keep it a little short, is kind of the same formula for reducing the risk of all diseases of aging. Well, one, we cannot modify our age. That's the biggest risk factor. So can't change that. So we will age. But the other big risk factors are alcohol and smoking, risky behaviors, drug abuse, these kinds of things. People are accepting them. I mean, it's totally normal to have a glass of wine every day. Hey, not far from France, and people do this all the time. But people have to be aware if you are concerned about breast cancer whatsoever. These are things. I'm not saying like drop the alcohol completely. I mean, you just have to be aware of the risk. And when it comes to breast cancer, it's a multifactorial uh, reason why people get breast cancer. It's not just, oh, it's the alcohol, or I had a a bad lifestyle. There's so many things that go into it. There's usually it's the genetics, and then there's the environment, and then there's some kind of a trigger for all these diseases of aging. So what is it exactly? I don't know. But if you, I mean, in terms of each person's individuality, it'll be many things. But if you want to lower those risks, it's really wise to have that healthier diet and lifestyle and lower those risky behaviors. And when I say healthy diet and lifestyle, that means whatever it is that's working for you, because people have allergies, they have intolerances. And so I'm a diet agnostic and everyone has to figure out what works for them. But generally what the research does show is a Mediterranean style diet is quite good for anyone who wants to lower the risk of any diseases of aging, especially cancer. But tell that to somebody who lives in Asia. It's very expensive to have a Mediterranean diet in Asia. So I do like to say, well, there's certain elements of an Asian diet that are also really, really good to lower breast cancer risk. And I've interviewed Dr. William Lee. He's a leading expert and he's a researcher in cancer in general. And his number one food for lowering risk of cancer is soy. And there's soy gets a bad rap for many reasons, for other for other reasons as well. But when he talks about soy, it's not soy burgers and this soy processed soy that we're eating very often in the U.S., but we're talking about edamame or whole soybeans or tofu or these kinds of things that you would find in a regular Japanese diet. And so those are just some of the elements to do in terms of lowering that risk. And I have to say also, in general, stress is a big component too. We don't pay enough attention. We always talk about diet and exercise and all these things. It's true, these lower risks, but sometimes stress can hijack some of those efforts that we're making. And behooves us to pay a little bit of attention on how to manage that stress. Stress isn't bad. It's not going away. We just have to know how to manage it.
It's so fascinating that all of these different diseases, whether it's breast cancer, cardiovascular disease, dementia, osteoporosis, they all have this common elements of diet, lifestyle, exercise, having powerful influences on whether you get it to begin with, and then also what happens afterwards. And it's fascinating also how over time recommendations have changed. I mean, soy used to be absolutely recommended against if somebody had breast cancer or even was at risk for breast cancer. Now we know that that's just not true. Just like HRT, hormone replacement therapy, estradiol in women was thought, for decades went out of favor because of one study showing that was quite flawed. And now that has been debunked. And so HRT is coming back in favor. And we know that it's safe for most women. But the reality is the risk for different diseases changes over time as well. And so when you get, and I know that you know this, but I'm leading up to set up the next bucket of questions, I promise. So
I know it's super interesting. I'd love to hear what you have to say.
so as we go through, by age 50, and you start going through that perimenopause and menopausal transition, the risk for breast cancer starts to decline because your estrogen is declining. And however, by the time a woman is 50 years old, her lifetime risk at that point for an osteoporotic fracture is greater than her risk for breast cancer. And so
Mhm.
that switches the emphasis and the focus for me at least. But there is no major campaign for osteoporosis. There's no, there's an osteoporosis awareness month, but there are no marathons and that sort of thing. I'm curious, the women that you work with, and as osteoporosis is now, sort of more on your radar as you transition into understanding that and having amazing conversations and topics and educational content that you've developed around that. What do you find are some of the biggest questions or blind spots that women have about osteoporosis?
Oh, there's so many. Where should I start? And I was fascinated as I dug deeper into this topic, and I've learned so much from you. And when I get more and more women coming to me with osteopenia or osteoporosis, the fear that's there is real. And the misunderstanding that they don't realize they can change their trajectory. They can reverse this, and they have a good shot if they do certain things, put certain things in place. And so that's one thing that they're surprised about. The other misunderstanding I think that we all do, including me, and I changed that since speaking a lot with you, is we put too much emphasis into a score, a T score or a DEXA or this number. We think it's has so much weight, and we get scared if we have osteoporosis or osteopenia, but then we stop doing the things that we probably should be doing, and we could lose 10 years of bone building efforts, because we fear that we have weak bones. And then the other thing that I think we don't put enough emphasis on is the balance and the necessity of not falling in the first place. Like fall prevention is really, really important. And we had a whole course on this in my gerontology studies, because it's so important. So it's good to weight train. It's good to do impact exercises, all these things that we see online. However, I think some people are missing the point that some people can't do that quite yet. Maybe they shouldn't be doing that quite yet. They need to build up to this, and people can hardly balance on one foot. They can barely walk. And so, if the fracture risk, right? You were the one who mentioned to me there was like over 90% of fragility fractures happen because people fall. Well, then the game is to really not fall. So why aren't we teaching more, talking more about balance and mobility, agility, these things that are super important for aging? And so I would really think people need to focus a little bit more on that. I've met plenty of women who are in their 40s and they can't balance. And if you're like that in your 40s, what's going to happen by the time you're in your 60s? So it's really important to not forget that piece of the puzzle and look at fracture. And why we talk about fracture, you've said this over and over and over again in your podcast. Anyone who's been listening to you, they know that if you have a fall, if you have a hip fracture, have a hip fracture, you have a 30% chance, or up to 30% chance of dying within a year. And that's a pretty scary statistic. And it's kind of like you said, where we're so focused on cancer and worried about some of these other diseases of aging that in fact we're not paying enough attention in term to our bones and our bone health and osteoporosis or low bone density and the fractures and the falls. Why aren't we focusing on that? And so that's why I'm here to be right behind you and support you in everything that you do, because we do need to bring more attention to this.
Well, and I think one of us is not behind the other. We're side by side attacking this and really both passionate about, working and doing whatever we can with our unique voices, our unique background and histories to try and move the needle on this. Because unfortunately, in the US at least, 95% of eligible Medicare age patients, 65 years and older, by definition, the highest risk category for bone loss and osteoporosis, are not getting screened with a bone density test. The test isn't even happening. You live in
No.
Portugal. So I'm
Mhm.
curious to know what you see there. What do you learn globally when you talk to people, not just from Portugal, but in other parts of the world that you come in contact with? What are you learning in terms of their experiences with screening, diagnosis, approaches? I'd be really curious to hear that.
Yes, to give people a background, I'm a recovering nomad. So I'm now in Portugal, but a nomad. I was living out of a suitcase and for years and years, and I traveled the world. And I was very curious to ask questions about aging, about menopause. And so I literally stopped people on the street. I asked them 5 questions about menopause. And some of them will speak to me. Get a lot of rejection as well. And I post these, I put them into 1 minute reels and post them on my social media. But it's super interesting because the questions I ask are menopause focused, but always towards the end, I always ask, have you had your bones checked? And these are women who are in 40s, 50s, 60s, 70s, 80s, more or less, some 90s here and there, but mostly in those 40s to 70s category. And the answer I often get is, oh no, my bones don't hurt. I'm okay. So they don't even
I don't even
think
know.
they don't understand that we don't feel our bones getting brittle. They're talking about joint pain, which is, also we need to pay attention to that. But they're not getting screened. And I asked them, have you been screened? No. And unless maybe you get a better chance of a woman who's in her late 60s or over, she may go, yes, I've had a bone screening and my bones are, usually the answer is I have osteoporosis. So, once in a while you get women who say, I've had it screened and I'm all good. Some women say I've had it screened because I fell. And so they had to do a scan. And not all these countries are or don't have access to medical care. And it is interesting because mostly when I'm in Asia, I would go to Vietnam, Thailand, Hong Kong, and then in Europe, of course, many places in Europe. And it seems as though it's not. You would think sometimes these women would say, "Oh, I don't have enough money, or I can't see a doctor," and that's be the case because I do notice big disparities between a woman who I interview selling fruit on the street and a woman who's in front of the Gucci store. So they have different experiences of menopause and different answers as well. But the ones who are if you who they do mostly have access. There was one thing that was really interesting in the Philippines. Even though they had access to medical care, you can debate all you want whether it's good care, bad care. That's another story to talk about. But they are afraid of doctors. They say, I don't want to go to a doctor. I'm afraid I don't want to. And they very sometimes they just say I don't go to a doctor. And I had to ask sometimes the translators, and this is in Vietnam, for example, because in the Philippines, I speak English, but in, say, a place like Vietnam or Thailand, and they would say, well, I don't see a doctor. And I had to ask the translator, well, does that mean she's proud, like I don't see a doctor and I'm so healthy, or she's saying I don't see a doctor because I don't have money because I can't tell, I don't speak Thai, and usually she just says no, it's just a matter of fact. She's not trying to say anything or have a hidden message. So I found that really interesting. But they do have, the point is that many of these places do have access. Sometimes they just don't want to, or they're scared, or they just not aware. I think it's more they're just unaware of bones and bone health. I mean, we're unaware very often in the West. It's even worse in countries in Asia and some of the countries I've been to in Asia.
Well, even if somebody does go to a doctor, what I've seen in several studies, they were both in Europe, but I don't think it's really much different anywhere else, is that overall doctors are confused about how to interpret the test results. They're confused if they should recommend a medication, what the best medication is. They're not trained or comfortable having the more nuanced, complex conversations around diet, lifestyle, exercise, and how to counsel patients about them, nor do they have the time in these short visits. Does that mirror your experience?
Absolutely.
Well,
Yeah. So I have my own experience, and with the women in my community who I speak to regularly who are in Europe, and many of us are say Portugal, Spain, France, Germany. These are is Sweden, kind of all over the map in Europe. And very often, yeah, most often we would get say a DEXA scan, and we would say, well, what do we do with this? This is okay, you've got osteopenia or you have osteoporosis. Just go for walks and take calcium across the board. Maybe you're lucky if somebody says, oh, do some strength exercises. No instruction what that even means. And most people don't know what is strength training. They need, so you are lost completely. And it's a real pity because if you, that's all you do is take calcium and maybe vitamin D, sometimes they would tell you, you're not going to see improvement. And even when I get DEXA scans in Spain, I've improved my bone density over time, which is great. But I get a look of shock on the woman who is taking the screening because she says, "Well, normally the trajectory is going down," like as if she should never sees an increase in bone density. So there isn't enough training. It is definitely globally. Maybe there's some places in Europe that do exist, but then it's most likely somebody who's a functional medicine doctor who has the time or who can give the information. But just regular doctors here, no, you're sent home with no plan and no guidance.
it's so tragic that that's the general understanding among healthcare providers is that it's a one-way street, that you just start losing bone and there's nothing you can do about it. That's it. And that's so that is bears no resemblance to what the research shows. The research is very clear. The bone loss can absolutely be stopped and reversed using integrative approaches, but also that we can maintain bone strength and reduce falls and fracture risk using integrative approaches too. And the fact that the medical systems globally are not approaching this with that knowledge in this way, incorporated into their protocols, is leading tragically to death, to people dying and communities being impacted and families being impacted and people living their final years out in chronic pain. Because oftentimes the first symptom, as you mentioned, talking to women, well, I haven't gotten screened, my bones don't hurt, I'm not in pain. Well, the first symptom of osteoporosis is typically a fracture, that there is no overt pain or discomfort. So with your community out there, your tell me about that, because I find what you've done and people who've created robust platforms for these discussions and dialogues and exchanging and sharing best practices and information to be a filling an important need in the healthcare system, because this information is not being taught in medical schools, and yet it's in medical research. And that's why I wrote my book, and why you and I think are both very passionate about how we're approaching it, given our, unique, interests and skills. And so tell me about what you've created.
So when I say community, I have a private community, so members pay for a membership. I have community on social media, and I hear from them all the time, answering all their questions. And then we have the community, physical community at large, women I just speak to on the street or who I approach. So when I say community, it could be mean so many things. Also, I'm connected to other menopause experts and podcasters and things, and I tap into their knowledge and their community. And so we see so many we have so many similarities, and we see so many things. And in terms of menopause in general, lack of information, just like lack of information for bones, lots of fear, anxiety, and stress about this transition, but also fear of getting older and fear of disease and fear of these things. And on one hand, it's these are women who are in their 40s and 50s, generally, some 60s. And the good thing is, I think, about some of this fear is sometimes it projects you to go look for information. What can we do about this? And when you see somebody talking about, wait, we can reverse osteoporosis. This is not a death sentence. We can reverse menopausal symptoms. We can be bigger, better, faster, stronger as we age. Well, then they're attracted to that and say, okay, well, what can I do? And the principles are very simple, and it's very often the things we know. I'm in the biohacking space, so I also love the gadgets and the testing and all this cool supplements and peptides and like all this stuff. But there's no point in talking about all that if we don't have the foundation. And I think very often, well, at least I'm attracting the type of woman who wants all that extras because they want to bypass the foundation. And unfortunately, it doesn't work, or it doesn't work as well if we don't get this foundation in place. And yeah, it's just hard to do these things. That's why women do come together as a community, because you have people holding you accountable, you have people cheering you on, you have people supporting you, you have other people saying, you know what, I'm feeling that too. And this is what I've done, and this is what's worked. This has not worked. So community is so important to any woman who's listening now, who feels alone in this transition, who feels like the only one, and no one really wants to talk to you. Please tap into a community. Go find a friend who's uh, in going through menopause herself. Open up that conversation. Don't be shy. It's still taboo in so many places, but honestly, you're going to feel so much relief, and that person you're going to speak to is probably going to feel really, really relieved too. And if you need me to connect you to somebody, just reach out to me, and I'm always happy to support you, because you definitely are not alone.
In our parents' generations, it wasn't talked about. I'm really glad to see it much more discussed. And my wife is going through menopause now, and as the spouse, experiencing this along with her, it can be, I think, as confusing to the partner as it is to the woman going through this. And you know, to understand, I'd like to actually, how do I say this? I want to see if we can help some of the men out there who might be listening to this, or if a woman's listening to this and this is providing helpful information that you think might be good to share with your partner, to help them understand, to be able to support you better. I really encourage you to share what we're about to talk about with them, because for me, it's confusing as the partner. And for women, things my wife has said, and she's very public about this, and she posts on social media about her experiences as well. I think I'm going crazy. The libido drops, skin starts to become drier. She was losing some hair. All of these changes in her body, starting to get more fat deposition in places, and feeling less energy, and more fatigue and brain fog. All of these things are symptoms of sex steroids or women's hormones declining, like estrogen and progesterone. And for us men who, yes, we can have hormones decline and it can affect us, but obviously it's not as common, and we're just kind of going along, and suddenly the ground is shifting under us and we don't understand. We're like, what's going on? And I still have a libido, and let's go do things. And why are you crying? Or what, so help men understand what it's like and what we can do better.
Oh, that's such a good question. I'm so glad you asked. So there were 103 documented menopause symptoms. This
Oh
is
my
in the
God, I didn't know that. 103.
103. And
Wow.
you listed maybe the 10 most common ones. That's the one we kind of look out for. And most women are thinking about too, the hot flashes and the loss of the periods or irregular periods. So that's really what people are looking at. But in fact, there's so many more things that are related to the loss of our hormones. And it could be a menopause symptoms. Now there's a lot of overlap. Maybe it's a thyroid issue. Maybe you are really sick. Maybe you have some serious disease and condition. That's why we have to look first at, I always say, look at first the hormones. And if that's the culprit, well, then it's very simple to support those hormones with hormone therapy, balancing them out with your diet and lifestyle as well. But so that's the first thing, is to understand there are 103. And because there's so little information, and because it was a taboo topic, the woman doesn't know what's happening to herself either. Like, we're the generation that's just waking up now. The generation before us was completely lost and had no information, no access to the information. Nobody talked about it. So those poor women are completely lost. Whereas we at least we have the opportunity to find out what in the world is going on. Sadly, our doctors are not trained in this. There's no hardly any menopause education in medical school. So most doctors will not be very helpful in this situation. So the women that we have now in this generation are educating themselves. They're trying to figure it out. That's why they go to social media. That's why they read books. That's why they listen to podcasts. And they will find conflicting information. So not only are they going through menopause, but they're going to hear two different experts say two totally different things, and they're even more lost. And so this is why I try to bring this all together and help women decipher this and how to make decisions for themselves. So you can imagine, if she's lost, she doesn't know what she's going on, 103 symptoms of menopause. How can she even explain to you what's going on? So there's a change. This is a transition. Now, 25% of the women feel nothing. Right. So you may meet women who are like, well, I don't know. I don't feel anything. Nothing's changed. Not that nothing's happening under the hood. They're just not seeing those maybe 3 or 4 symptoms that they're looking for, not experiencing them. So with that in mind, say, okay, well, they have about 25% women on the other end of the spectrum feeling everything, almost 103 symptoms, and they're very intense. And then we have the other 50% who are somewhere in the middle. And so the best way to support her, I think, is to learn with her as she's going through this. I know you need to be patient. We have to understand this is a transition, but also know this is not forever. This is just a blip on the radar. This is just a period of time. Unless she accepts it as her new normal and then believes this. It's like the same thing for aging. People start shuffling, accepting being tired all the time. They don't exercise anymore. They think it's normal. Okay, I'm just in age, and that's sort of the worst ageism possible, to have it self-inflicted because you're believing this and you're going to go down this trajectory. So the same thing can happen with menopause. We don't need to accept it. And if you want to, that's fine. It's your body, your life. But if you're with a partner and you want to have the best outcome, then you educate yourself and you realize that I can reverse these menopause symptoms. I will not have low libido all my life if that's important to you, right? And you can the woman who's going through hot flashes and all the difficult symptoms and the dry vagina and the dry skin and hair falling out. Like, the last thing she's thinking about is having sex, because she feels like garbage and her body's changing and she doesn't recognize it
And
anymore, and she's
sex can
feeling.
become painful. I mean, you can get vaginal tearing and the walls, you know, they thin and become drier, and so everything. I mean,
Yeah.
everything. This is the conversations that we've had, and that's just younger women have, most of them at least, a sex drive, and there's that sexuality and the sensuality, is part of all of our, as being humans, part of our identity, and who we are. And when that changes, the rug gets pulled out, is just one of these, several of these 103 symptoms. It's also like, who am I?
Mm-hmm. Yeah, absolutely right. If somebody is feeling pain during sex, like who wants that? Like it's not going to be something she's going to be looking forward to. But we have solutions. We have vaginal estrogen, which is a cheap solution for this, and it's going to help her with many other things in the future, for her future self as well. So if you knew that and say, oh, if that's the root cause, if that's the problem, because there are a whole can of worms when you talk about sex and libido with women going through menopause. Boy, I have all the episodes on it. Some of them have a childhood trauma. Some of them have had the painful sex, a physiological problem. Some have biopsychosocial. Like there's so many reasons why women may have a low libido during this period.
When you
So
say you have all the episodes, that's on your podcast interviews.
yeah, yeah,
Yeah,
yeah,
so everybody make sure you check those out. The link will be in the show notes. Hack My Age podcast.
yeah.
Yeah.
Yeah. So there's many reasons why. If it's just a physical problem, if it's just the tearing and the dryness, like, wow, we have great solutions for that. Now, if you've been sexually abused as a child and then, then it's going to take a little bit longer. But if you are motivated and if you want to have more intimacy with your partner, because plenty of women I meet say, well, I could never have sex again. Like I'm fine with never
Yeah, some of them
ever
don't
having
want it.
sex again.
Yeah.
And I said, well, does your partner, can he also live like that? I mean, and if you can, great, but if you have a difference between levels of libido, then you still want to be with that partner, well, then it behooves you to do something about it. And it's not about, okay, let's learn how to have a great orgasm. It's about, for me, and at least the women I'm seeing in the community, is more about intimacy. We want to be intimate. We want to have connection. It's not just about the penetration. Like that's one part of it, but it is so much more about that. So the women may be going, well, I've been having sex like the same thing every single day for the last 20 years, and it's the same routine. And she's pretty much told, like, let's just go eat at the Mexican taco stand every single night. No change. But she may want the Italian gourmet meal. Like, that makes kind of sense. So maybe then there's like, okay, things we need to do in the relationship to spice things up to make it more interesting for both partners. Because if it's interesting for her, then obviously it's interesting for him too. And we're talking about heterosexual relationships because there's all kinds of relationships out there. But generally speaking, if it is important to us, then yeah, and you need to pay attention to it. But life is so much better when you think about when you first met as a couple, that energy, that excitement, that connection, that intimacy. Like, wouldn't you want that back? And I think it's great. But if you're going to be married for 30 years, well, then we got to figure a way to bring that back. And you definitely can. There's so many ways to do it. And again, it depends on sort of what is the reason of the low libido. And once you target that, then life is good again.
And maybe the concept is, go back to dating. What was it like when we were all dating, our spouses for the first time in the first several weeks and months? We were getting to know them. What did they like? What do they need? What makes them feel good? How can I help them feel better and special and loved and important? If we have that mindset with each other, I think it'll go a long way to not only helping each other, physically and emotionally feel better, but be more supported and have better conversations, and conversations that can lead to solutions instead of stress and anxiety and heartache. I want to touch on hormones for a second with you, because we've only talked about estradiol or estrogen, and I mentioned progesterone. You mentioned estrogen, vaginal suppositories. What are your thoughts? And I have my own thoughts, but I do want to just know, what are your thoughts on testosterone, if you have any, in women?
Definitely a hormone to look at, definitely to consider in terms of whether you want to check your hormones. It's much easier to test testosterone than it is to try to catch an estradiol or progesterone's going up and down all over the place. And many women actually have pretty good testosterone levels all throughout menopause and perimenopause. It's not unusual. So it's not like it all falls off a cliff like some of the other ones. So I would always say, encourage people. I'm into the biohacking space. I love to test, measure, and assess. Like, test yourself. Are you really low? If you're low and you have a low libido and you find it difficult to get motivated to go to the gym, then it's something to consider to bring into to top up when you need it. And if and so that I'm not and there are many ways to take testosterone. There's gels and there's creams and there's injectables and troches, and so it's the same thing in terms of other menopausal hormones. It's like you can find what works best for you. And but I'm very pro testosterone. I don't see any reason why, if somebody's interested in topping up and optimizing their testosterone, absolutely. And there's emerging, right, evidence that you probably know better than me that it helps as well with bone and bone turnover, right?
Not the testosterone directly. So it's thought really it's more the testosterone converting to estradiol. And
Mm,
the testosterone in women and what the research is now supporting is when libido's low, when they're not, not wanting to have sex, having that emotional, depression because of it or lower mood. That's where testosterone can be helpful, where estradiol is not. And so
mm,
there are quite a few medical organizations around the world, over a dozen, that actually recommend in women for those symptoms, low libido, depression, who are peri and postmenopausal, to test their testosterone and replenish as appropriate to optimize it and get rid of, and those symptoms improve. And that's one thing that testosterone seems to do: motivation, libido, that estrogen alone does not do as well. And so for me, I do like to get, for all women as a baseline, include the total and free testosterone in their sex hormone testing, because women do need some testosterone as well, just like men do. And similar in men, it's the testosterone is important for bone health, but it's converted into estradiol. Men have estradiol as well, and it's the estradiol in men that is responsible for maintaining and building bone.
So it's like a double whammy. You can take testosterone and indirectly it builds the bone, and at the same time, you may get some benefits of other estrogen benefits as well. So I what I'm seeing in my community, at least what it's the girls who are on to taking testosterone, they tell me, and again, if you talk to somebody who's really doing all this research into testosterone, they would argue this, but I see it in the community. So it's like, yes, you see it in the community, but perhaps the research doesn't exactly support it. And it's motivation. The women who are getting the testosterone, they would say, well, now I'm building muscle because I'm motivated to go to the gym, and now I'm going to the gym and I feel good, and so I eat more protein, and so they're building more muscle, they're feeling better. That muscle's pulling on the bone, sending the signal to go and and lay more bone. So it's there's so many wonderful downstream effects that can happen with testosterone. So I personally go, well, I don't care if the research doesn't really support it. I see it, and if it's working for the women, like all for it.
Yeah. If you were to design a system that allowed women to, kind of have that support, have the information they needed, was self-empowering to them, how would you, I mean, you have your group as well. Is there anything within, kind of what you're already doing in the system that you've created, where you think there's a gap where there just aren't even any groups out there because of laws, or because what you can or cannot do, or services you can provide, where these groups and women exchanging information, what would be helpful additions to those groups if you were to help even them, try and help them even more?
Mm. So an existing group, or if you're saying for a woman who is no community at all and she's a little lost.
That the latter.
Okay. Yes. So it depends on what your style is, right? There are women who are all over Facebook. They love Facebook. They're not Instagram people. They don't really even talk to humans. They just prefer to be on Facebook. Like you're if you're in that camp, then okay, let's start with Facebook. There are many women's support groups on Facebook, many of them for menopause. But if you're somebody who's like, no, I don't like social media, I don't want to do this, well, then there are menopause cafes that are popping up
Oh,
everywhere.
really?
Yes, and you can search those, you can Google it, and you have a cafe in-person meetup where you just go and talk about menopause. There's death cafes too. I don't know if you've heard about that, where people
Oh,
go and talk about death. Like, it's incredible, and it just shows the need for human touch and that those high touch meetups. So you can find people who are open and ready to talk about menopause. And the other easy thing to do is your closest friend, if you feel comfortable with that person, female who's going through menopause, hopefully too, you open up that can of worms and you just start talking about menopause. But I think with internet, with social media, we have so many avenues to not feel alone. You can also start by just listening to podcasts and reading more about menopause and understanding that if there are 103 symptoms and you're feeling definitely some of those, there are others who are feeling it too. And as we open up this conversation, this is why I stop women in the street. And I know that they've never spoken to their mother about menopause or anyone about menopause. Now they're feeling a little bit more comfortable. I've given them a voice. I've given them some vocabulary. I've shown them it's not that big of a deal to talk about menopause. And actually, you're going to feel better if you do.
I love it. I love it. Any parting words of wisdom? Anything you'd like to let people know?
Well, when it comes to menopause and even osteoporosis or osteopenia, these are things that you can reverse these symptoms. You can reverse these things. You have to find out, and it's all very bio-individual. And as pro hormones as I am, you can't just take hormones and go, okay, that's going to be the final solution, and I don't need to do anything else. No, we need to detoxify these hormones too. We need to improve all aspects of our lives if you want to age well and be at your optimal game as you're going through this. So I think one is we can change these things. You do not need to suffer. I always say menopause is inevitable. We will all go through it unless, we have some new new science coming out. Until then, we will all go through menopause, but we don't have to suffer. So suffering really is optional. And if you want to, that's your choice. But if you don't want to, please seek out help. I've got in my website, I have a blog article on how to find a menopause trained professional, a doctor, somebody who can help you through this in your region, no matter where you are in the world. I've helped a woman in Kenya find a doctor. So
Amazing.
it's possible. It is possible. So please know that you're not alone and all of this stuff is reversible.
And what is your website? How can people reach you and find out more?
Hackmyage.com, and it's all social media is hack my age, and the website is there too. If you just reach out to me, I'm very accessible, whether it's by email or by social media. Please let me know how you're doing, and if you need any help, any support, honestly, I'm here for you.
Love it. Thank you for the great conversation today. I always learn new things when I talk to you. I'm so grateful for it. Thank you.
Thanks, John.